You will need a cannula pack containing the cannula, a dressing, gauze, a sterile sheet, the cannula stickers. You will also need a tourniquet, a connector, saline flush, a syringe, a green needle, and an alcohol swab.
Cannulation is briefly demonstrated here, and in more detail later in the video. Put on some non-sterile gloves.
With your green needle and syringe, draw up your flush. Fill your connector device. Place your patient's arm on a pillow and place a tourniquet.
Palpate a suitable vein. The ideal place is the back of the hand or the forearm, avoiding the elbow or wrist joints. Rubbing a vein can help them to fill.
Clean the vein with an alcohol swab and allow 30 seconds to dry. Warn the patient of a sharp scratch. Enter the vein with your cannula. Advance the cannula over the needle at a reduced angle. Remove the tourniquet and place pressure proximal to the cannula. Remove the needle and dispose of it into a sharp spin. Quickly connect your connector, or bung if you are using one. Flush the connector, warning the patient that it may feel cold. Place the cannula dressing first by sticking down the wings and then with the clear dressing. Make sure not to obscure the site just proximal to the cannula, as this needs to be clearly visible for any signs of phlebitis. Place the review date sticker next to the cannula. Ensure the sticker supplied is completed with the relevant details and placed into the patient's clinical notes. If this is not available, then document the procedure briefly in the clinical notes.
We can now show in more detail the technique used to cannulate, this time on a different patient. After selecting the area, use your non-dominant hand to stretch the skin distal to the point of cannulation. Warn the patient of a sharp scratch. Enter the vein at approximately a 15 to 30 degree angle to the skin. Advance the cannula into the vessel to the point where flashback of blood can be seen. Remove the needle by a few millimeters so that some of the needle remains in the cannula and acts as a guide. At a much less steep angle, the cannula can then be advanced into the vein. Release the tourniquet and place pressure proximally to the cannula. The needle is removed and disposed of immediately into a sharp spin, and the blind cap or connector can be attached. Apply an appropriate dressing and flush the cannula through the top port or connector. When flushing, observe around the cannula for any signs of extravasation or any pain.